Only a few years ago, HIV services, including HIV testing, were not accessible for remote rural communities in Armenia. There were no conditions, no trained personnel for provision for those services. On the other hand, complications associated with lack of habit to undergo HIV testing before the clinical manifestations created the necessity of approaching the mobile services to those who need them. It is well known that people in our society are reluctant to undergo an HIV test, mainly due to stigma associated with HIV/AIDS. Therefore, provision of the test as a part of the services package makes it easier for people to undergo HIV testing. In Armenia, mobile clinics are operating under the Russian Technical Assistance Program for HIV/AIDS and other infectious diseases prevention, control, and surveillance in Eastern Europe and Central Asia. Starting from 2013, the program is being implemented with the Russian government support. It is realized by UNAIDS, AIDS InfoShare, and Rospotrebnadzor. First mobile clinic was granted to the Armenian National AIDS Center under the Russian government-supported program in 2014, the effective operation of which contributed to granting of the second clinic in 2016 and the third one in 2019. The mobile clinics have operated effectively during these 5 to 6 years. They, as I've mentioned already, have traveled all through Armenia, several thousand kilometers. They reached people who are in need of health services. The clinic equipment allows providing a comprehensive package of HIV services, including HIV testing and counseling, testing for hepatitis B and C, and syphilis. Medical consultations and TB screening are also provided. In addition, ultrasound examinations are conducted. Therefore, HIV testing appealability is being increased, and conditions created at the clinic make it convenient for the medical personnel and attendees. Mobile clinics have an advantage of provision of HIV services on site by the specialists, who are not residents of local communities, which, in turn, improves appealability and ensures maintaining confidentiality. The clinic operation has allowed implementing HIV preventative activities among the most vulnerable to HIV population in Armenia, labor outbound migrants and their family members in remote, urban, and rural communities of the country. Often people, though realizing that they should undergo HIV testing, avoid doing it, but this avoidance has serious consequences for their health. In any case, getting tested is necessary. The mobile clinics operation has already maximally brought HIV services nearer to those in need. This created broad access to HIV testing and counseling, which in turn improves early HIV diagnosis and timely provision of treatment and care. When the clinic arrives, people go there and get tested. It's free, anonymous, and rapid. In due time, not many people were interested in laboratory testing, but now people apply for testing more often. especially the youth, men returning home from outbound work apply for testing on their own in order to avoid problems. The mobile clinics work in communities in accordance with the preliminary arranged schedule on which the community members are informed in advance. Daily, on average, 20 to 30 visitors are provided with the mobile clinic services package. The testing results are provided within 10 to 15 minutes. HIV preventative activities implemented among the migrants and their family members by the National AIDS Center are very important because they help to raise HIV awareness of the population, which in turn builds their motivation to undergo HIV testing, forming safer behavior, decreasing the risk of HIV infection. For a long time, we have been closely collaborating with the National AIDS Center. I would like to emphasize that when the project was initiating, the actual idea of using mobile facilities belonged to Dr. Grigorian, director of the National AIDS Center. As a matter of fact, this idea was born out of consultation with Samvel Rafikovic, for which we are really grateful to him. Since 2013, more than 60,000 comprehensive packages of mobile public services on HIV and hepatitis B and C STI testings were delivered by the National AIDS Center to the population most vulnerable to HIV in Armenia. Migrants, their families, and community members in about 300 rural and urban communities. More than 120,000 motivating consultations were provided to the beneficiaries. Thus, these 3 mobile clinics have traveled about 150,000 kilometers all through Armenia. Testing in the mobile clinics is not the end in itself. HIV-positive cases are referred for further testing at the National AIDS Center, and upon confirmation of HIV diagnosis, patients are followed up, receiving free treatment and care. Seropositive for hepatitis B and C and STIs, as well as TB suspected cases, are referred for further diagnosis, treatment, and care in specialized medical institutions. The mobile clinics are also used during various public events to raise awareness, popularize, and to encourage to undergo HIV testing among the general population. More than 7,500 people have been HIV tested at 75 public events held by the National AIDS Center in 13 Armenian communities under the Russian government-supported program. The model on provision of public health services package introduced by the National Center for AIDS Prevention of the Ministry of Health was successfully implemented in 2 other countries, Tajikistan and Kyrgyzstan. Bringing medical services near to the population via the mobile clinics and application of innovative methods of infectious diseases diagnosis and treatment in Armenia is an important component of the response to HIV. The National AIDS Center will continue effective implementation of the specified activities through its 3 mobile clinics, allowing more people to be tested, take care of their health, be informed, and protected.